Caged revenge at Broadmoor.
Broadmoor Hospital, 1977. A quiet corridor. 3 men enter a therapy room. 2 patients. 1 marked target. The door jams shut. Staff shout. The handle won't move. Inside, a ligature is pulled tight around David Francis's neck. Strangulation is swift and unforgiving. The squeeze collapses the carotid arteries, so oxygen-rich blood can't reach the brain. Jugular veins clog. Pressure surges. The airway narrows. Every breath turns into a failing attempt to pull air past a crushed windpipe. The vagus nerve can misfire, shocking the heart into dangerous rhythm. 10 to 15 seconds. Vision tunnels. Consciousness fades. 1 minute. The brain is starving. Seizure-like agonal movements start. 2 to 3 minutes. Irreversible hypoxic brain injury. The brainstem can't drive breathing. Without oxygen, the heart slips into cardiac arrest. When staff finally breach the door, it's too late. No pulse. No spontaneous respirations. Resuscitation efforts can't reverse the damage. The Dining-Room Strangling. Broadmoor Hospital, 2004. Lunchtime on a secure ward. Chairs scrape, trays clatter. In seconds, a routine meal turns silent. Peter Bryan closes in. Richard Loudwell is pinned. Hands lock at his throat. Manual strangulation is brutally efficient. Compression of the carotid arteries stops oxygen-rich blood from reaching the brain. Jugular veins clog. Pressure rises. The face darkens. The trachea is squeezed. The airway narrows to a whistle. Laryngeal cartilage can bruise or crack. The vagus nerve may surge, tripping the heart into a fatal rhythm. 10 to 15 seconds. Vision tunnels. Consciousness drops out. 1 minute. The brain is starving. Agonal movements look like struggling, but they're just reflex. 2 to 3 minutes. Irreversible hypoxic ischemic brain injury. The brainstem can't drive breathing. 4 to 5 minutes. The heart slides into pulseless electrical activity and then flatlines. Staff rush the room. Restraints. CPR. But neck swelling and airway trauma make ventilation poor. The brain has already crossed the line. There is no return of a pulse.
4 hours of freedom.
Somerset, 1952. A siren hasn't sounded yet. A man who shouldn't be outside walks a country lane and spots a 5-year-old playing near home. Minutes later, they're gone from view. When she's found, there are marks on her neck and no breath in her chest. Manual strangulation kills by shutting the brain's oxygen off. Fingers and forearms squeeze the soft tissues of the neck. Carotid arteries are pinched so fresh blood can't reach the brain. Jugular veins backflow. Pressure rises. The face darkens. The airway is crushed inward. Air movement drops to almost nothing. The larynx can bruise. The hyoid may crack. A reflex via the vagus nerve can stun the heart into a dangerous rhythm. 10 to 15 seconds. Consciousness fades. Vision narrows. The body goes slack. Around 1 minute, the brain is starving. Any struggling is reflex, not recovery. 2 to 3 minutes. Irreversible hypoxic ischemic brain injury. The respiratory drive fails. Soon after, the heart slips into pulseless electrical activity, then asystole. When help arrives, there's no pulse, no spontaneous breathing. Resuscitation can't reverse several minutes without oxygen.
Vampire of Sacramento.
Sacramento, 1977 to 78. A front door cracks open. A hand with a handgun pushes through. Shots echo in small rooms, and the damage is immediate. A chest shot that tears the heart or great vessels causes a rapid hemothorax. Blood floods the chest cavity. Blood pressure collapses. The brain loses oxygen, and the heart arrests within minutes. A headshot drives shock waves through soft brain tissue. The cerebrum shuts down at once. The brainstem can't sustain breathing, and death follows in seconds. Abdominal shots that rip the liver, spleen, or a major artery unleash massive internal bleeding. Circulating volume drops below what the body can perfuse, and hemorrhagic shock spirals to organ failure. Victims in these scenes show the same fatal pattern: catastrophic blood loss or catastrophic brain injury from gunshot wounds. Agonal breaths may flicker. They are reflex, not recovery. Without immediate surgical control of bleeding, impossible at the scene, there is no path back. CPR can't replace missing blood or reverse destroyed neural pathways. When officers arrive, rooms are silent. No carotid pulse. No spontaneous respirations. Time of death is called.
The Butcher of Plainfield.
Plainfield, Wisconsin, 1957. A quiet hardware store on a cold morning. The bell above the door rings. A customer lingers at the counter. A .22 caliber rifle is lifted. A single close-range shot cracks the stillness. Bernice Warden drops where she stands. 3 years earlier, 1954, a tavern miles away. Closing time. Chairs up on tables. Another close-range shot. This time a handgun. Mary Hogan goes silent in seconds. Gunshot wounds to the head are mechanically unforgiving. unforgiving. A bullet entering the skull creates a rapid pressure wave and a permanent cavity through brain tissue. Critical circuits, cortex, deep white matter, brainstem pathways are torn or stunned. Intracranial bleeding spikes pressure. Cerebral perfusion collapses. Consciousness goes out almost immediately. Breathing stops as the brainstem fails to drive the diaphragm. With oxygen gone, the heart follows. First, a brief agonal rhythm, then electrical silence. On scene, there's no protective reflex, no purposeful movement, pupils fixed, no carotid pulse.
Broadmoor transfer. The Ripper.
Northern England, late 1970s. A quiet street. A shadow steps from the dark. A hammer rises. The first blow caves bone. The second scrambles the brain's electrical signals. Consciousness shuts off like a switch. Blunt force head trauma kills by mechanical and pressure effects. Fractured skull plates drive inward. Brain tissue tears. Blood pools between skull and dura. An acute subdural hematoma. Intracranial pressure spikes, squeezing the brainstem until it can't run breathing or heart rate. Pupils fix. Breaths stop. Then, the knife. Deep thrusts open arteries in the chest and abdomen. The liver or spleen can rip. Intercostal vessels and the heart's great vessels can tear. Blood volume drops fast. Hemorrhagic shock. With less and less circulating oxygen, blood pressure collapses. The heart turns erratic, and organs fail in cascade. On scene, agonal gasps may appear, but they're reflex, not recovery. Without immediate neurosurgery and surgical control of bleeding, impossible on the street, there is no path back.
The Freddy Krueger Killer.
England, 2004. A man in a hockey mask steps from the dark with kitchen knives taped to his hands. 3 days. Front doors. Footpaths. Early mornings. The attacks are swift and terminal. Stab wounds killed by blood loss, airway damage, or the chest losing its seal. A deep cut to the neck can slice the carotid artery or jugular vein. Blood pressure collapses. The brain runs out of oxygen in minutes. If the larynx or trachea is opened, air whistles through the wound instead of reaching the lungs. Breathing fails even faster. Chest thrusts that puncture a lung spill air into the pleural space. Tension pneumothorax. The injured lung collapses. Pressure shifts the mediastinum and strangles the heart's filling. If the blade reaches the heart or great vessels, pericardial tamponade or massive hemothorax stops circulation abruptly. Abdominal stabs tear the liver or spleen. Internal bleeding pools silently. Skin turns clammy. Consciousness dims. Hemorrhagic shock spirals toward cardiac arrest. Agonal gasps may follow, but they're reflex, not recovery.
Bus 1170 Nightmare. Manitoba,
July 2008. Night run on Greyhound 1170. The Trans-Canada humming. A passenger naps in his seat. Another rises, silent, and the aisle becomes a killing ground. The driver brakes hard. Riders bolt into the dark. Doors sealed behind them. Sharp force trauma kills fast when it targets the neck and chest. Multiple deep knife wounds can cut the carotid arteries and jugular veins. Major pipes carrying blood to and from the brain. When those are severed, blood pressure crashes. Cerebral perfusion halts, and consciousness fades within seconds. Slices to the trachea or larynx steal the airway. Air leaks where it shouldn't, and breathing fails. Chest penetrations open the pleural space, collapsing a lung. If the blade reaches the heart or great vessels, circulation stops abruptly. The final act is cervical transection, decapitation, which instantly severs the spinal cord, the carotids, the jugulars, and the airway in one motion. The brain loses oxygenated blood at once. The brain stem cannot drive a single breath. Death is immediate, or within moments from exsanguination and apnea.
The Ossett Exorcist case.
Ossett, West Yorkshire, 1974. Night holds its breath. After an all-night church ritual, a husband and wife step back into their small, terraced home. Minutes later, violence erupts behind a closed door, and it ends before help can arrive. Neck compression is the first fatal mechanism. Manual strangulation pinches the carotid arteries, so oxygen-rich blood can't reach the brain, while jugular flow backs up and pressure surges. The airway is squeezed. Airflow falls towards zero. 10 to 15 seconds. Vision tunnels, consciousness slips. Around 1 minute, the brain is starving. Movements are reflex, not recovery. 2 to 3 minutes, irreversible hypoxic ischemic brain injury. The brainstem can't drive breathing. The heart follows. Superimposed sharp force trauma accelerates the collapse. Deep incised wounds open major vessels in the neck and face. Blood volume drops fast. With circulating oxygen falling, blood pressure crashes. Hemorrhagic shock. Pulse thins. Skin cools, and electrical activity in the heart unravels into cardiac arrest. When responders breach the scene, there's no carotid pulse,
If you enjoyed this animation, please subscribe for more and support my small channel. Share your ideas for the next video in the comments.